Hello, welcome. My name is Anita, member of DanGH, and today we are going to learn how to fill a screening tool. This is not all the information that a screening tool should look like. So, for the sake of perfect tutorial, I'll just do everything digital so that you have a fair idea of what it means. For the meantime, I hope you enjoy how to fill a screening tool. And this is when you've had a postnatal check done or a woman in labor. This is for women, a woman in labor, pregnant woman, postnatal, and she's showing signs of sepsis and you don't know whether to commence the patient on a sepsis pathway or manage the patient under sepsis. Then you can always go for this. Now, someone will ask, what if she's having an infection? It depends on the level. The reason why we are using the sepsis bundle is basically to prevent or reduce the chances of patients having septic shock. That is the reason why we have the sepsis bundle was released. So if someone will assess a patient and wouldn't know whether to consider this an emergency or just manage like normal infection, this is the pathway to help you. So someone may have a normal perineal infection, just something that needs to see the GP, get antibiotics prescribed, have a wound swab taken, or probably have a sample taken and sent to the laboratory. That is fine. But if you are having certain cardinal signs that are indicating that patient needs to start a sepsis pathway but you are not sure, this is what you will need in order for you to know whether your patient is going to commence on sepsis pathway. And the good thing is, if you've watched my other video, I did a video on a sepsis, and however I didn't include the screening tool, and people kept on asking me how do we fill that, and I felt, yeah, we just need to learn how to fill that so that we can add it to our sepsis. So kindly watch my video on sepsis, postnatal sepsis, and postnatal sepsis means that you are doing a postnatal check, then you arrive at a conclusion that patient is having a possible infection. So you will need to screen the patient in order for you to know whether your patient is going to need a septic screen, a sepsis pathway management, and that is our sepsis bundle. So without wasting my time, let's get straight to it. So we are going to learn about our sepsis screen, and let's get straight to it. So the first one you want to talk about is patient details, and that is you filling the patient details. And how do we fill patient details? Remember our 3 forms of patient identification, that is patient's name, patient's date of birth, and patient's hospital number. So you write patient's name, patient's date of birth, and the hospital number over here. So let's say that my patient's name is Helen Johnson, date of birth 15 June 1989, and hospital number 2222. I am happy to write that details over there. Moving on to the right side, we have staff member completing the form. So who are you? That is the candidate. That is the date the candidate is completing the form, the full name of the candidate, designation, and signature. So candidate's date is, what is the date of your assessment? It is always, maybe they will say assume it is today, that will be your examination date. So let's say that my candidate's my date of screening is 19 February. All right, 19 February. Designation is going to be midwife, and the name is going to be my full name, Helen Johnson, and signature I will sign over there. I hope everything is perfect. Now coming down, we can see some calibrations, 1 2 3 4, and we can see some arrows moving along. Some is indicated by Y and some is indicated by N. What does it mean? It means that If there is anything that is not triggering, or you didn't take any of the box in column 1, column 2, column 3, you just move along the arrows moving towards N. If you take a single box or more than one, you are moving along the arrow indicating Y, which means yes or no. So let's say the point number 1, there are 3 questions over there they are asking. If you didn't take any of them, that is, if none of them qualified, you are simply, if none of them qualifies, you are simply moving to the N arrow. If a single one or 2 or 3 or more than 1 qualified, you are moving to the Y arrow. So you just need a single tick in order for you to qualify for a Y arrow, moving down to the next set of questions. If you didn't get any tick in your box, you move along to the end. Hope that is perfect. So now let's get straight to it. So the first point, our category 1 is saying that we have 3 questions here. It says, has meows triggered? When you did your postnatal care and you filled your meows chart, or if it was pre-filled, were there any amber boxes? Were there any red boxes? If it is, it means that meows triggered. If it didn't and you had all 0 amber boxes, 0 red, then it didn't trigger. So if it didn't trigger, no need to take this. If it triggered, you would take. So did meows trigger? Let's say your meows trigger, that is temperature rising, pulse rising, then you will want to take over here. The second one is saying that, does woman look sick? Where would you find this? Also in your your meows chart. When you look down the bottom of your meows chart, they will always indicate I don't know why I keep saying paragraph. They will always indicate your meows chart. Does patient look well? Yes or no? Or patient looks unwell? Yes or no? If your patient looks unwell on your meows chart, then that means that the woman looks sick. So you are happy to take this box. Now, the first one, meows trigger, so automatically we are going to move down to our Y. Whether we were able to take the rest of the 2 or we didn't take any of the 2, we're still going to move to Y because one of them triggered, or we take one box out of these 3 categories. Moving down, we have, or is baby tachycardic more than 160 beats per minute? This is for pregnant woman, whether in labor or not in labor. That is when you want to consider this. So this is not applicable. Therefore, you do not need to write any. As I indicated when talking about the paragraph, if something does not apply on it, simply leave it blank and never write any. Hope that is okay. So here we got 2 things that triggered that ticked over here. So definitely we are moving along the Y arrow down. Then we move down, we have 2. Could this be an infection? This is another category of questions they are going to ask. If we take 1 or more, we are still going to move down to the arrow Y. If we didn't take any, we move to the arrow N, which is moving all the way up to the right, stating low rates of sepsis, use standard protocol, consider discharge with safety netting, then consider obstetric needs. So if that is, we didn't take any of these, then we are definitely moving to our N. But if we take 1 or more, then we are going to move down to our arrow. So our question here says, could this be an infection? Now, here are some of the possible questions they want us to tick if it applies. Yes, but source unclear at present. What does this mean? Let's say that you did maternal observation, you did your postnatal check. Literally nothing is showing that patient has infection. For example, you were expecting that maybe when she delivered vaginally, she had a tear which was sutured, or she had a bruises which was infected. She literally had intact perineum. She was not a C-section mother. She has no breast sores or abscess. She literally has no abdominal distension or pain. In fact, we just do not know where the source is coming from. Then you will want to take this. So let's say that your postnatal care, definitely woman has delivered, probably had a tear or episiotomy that was sutured, or was even a C-section mother, so her wound looks infected, or her wound looks bloody and pussy, then we say that yes, our source is clear, so we wouldn't take this box. We remove down chorioamnionitis, endometritis. Here, obviously, chorioamnionitis. If it's a postnatal care woman, definitely you wouldn't consider chorioamnionitis because she has already delivered. Endometritis, you want to think about it because if she having inflammation in the uterus, then you can confirm that from the exam. Isn't I like to confirm, does my patient show signs of endometritis, inflammation, and that is indicated by abdominal distension, pain. Then if the examiner confirms with you yes or no, then you will want to take over here. So let's say that the examiner confirmed that yes, patient is showing signs of endometritis, you want to take. If there was no sign of endometritis, then you wouldn't take this box. Hope that is clear. Then moving down, we have urinary tract infection. Is your patient showing signs of infection? Painful urination, unable to pass urine, scanty urine, offensive urination, then you will want to take this box. However, if patient is not showing any signs of urinary tract inflammation, scroll along. Coming down, we have infected cesarean section or perineal wound. This is very typical. You assess the woman, her perineal wound, probably she had a tear which was sutured, or she had an episiotomy which was sutured. Is it infected? Or does she even have that wound? If she has that wound, you will take it. Now, let's say you were given a cesarean section woman, definitely, whether it is infected or it's not infected, once there is a wound, we can qualify by taking over here. We have influenza, severe sore throat, pneumonia. This can be confirmed with the patient. Can I confirm, Helen, do you have any so have you been coughing lately? Have you been experiencing sore throat? Have you been diagnosed any flu or pneumonia? Then she'll say no. Then there is no need to take. But never assume that your patient does not have sore throat or pneumonia. So you are going to not take. Please confirm anything that was not checked on the woman. Confirm either with the examiner or confirm with the patient in order for you to be on a safer side, and that is a correct documentation and safety measures. Is that okay? Because in real life you would have checked these, so why wouldn't you check during your examination anyway? Then we come down to abdominal pain or distension. If you did your postnatal check right, or even if the postnatal check was done for you in the scenario, however, they didn't show whether abdominal pain, they didn't state in the scenario, or you were doing the postnatal check, you will need to inquire about abdominal pain. Okay, Helen, I'm just going to have a feel of your uterus just to see if it's well contracted. If it's feeling tender or painful to touch, do let me know and I will stop at any moment. Is that okay? Then you palpate the uterus for contraction. Was there any distension? Was there any abdominal pain? If it is no, you don't need to take. Breast abscess mastitis. If you did your postnatal care very well, you would have inspected the breast. It doesn't mean that you are going to do examination of the breast and palpate. No. She has delivered, she has a very sensitive breast. What you will want to do is you will want to inspect and confirm with the examiner. Examiner would like to confirm, does my patient have any signs of mastitis, abscess? Is there any nipple sores, swelling, redness, or bruises around? No, you leave it blank. Then others specify. Others will be, is there any significant wound you are unsure of, or any infection that during your assessment you saw? For example, let's say patient experienced pressure sores throughout labor, or patient has a wound around the leg. That is other. So you will want to write specifically what it is and take. So over here, let's say our patient, we did take for perineal wound. That is, we have one information here that qualifies as for us to move along there. Why? Let's see what the why says. It says, is one maternal red flag present? Now let's look at what it means. It says that respond only to voice or pain or unresponsive. This is specifically for unconscious patient. Let's say you attended to an unconscious patient, but someone whom you have done a postnatal care on definitely responded to you, so that patient is alert. However, let's say you were with an unconscious patient. Is the patient responding to only voice? That is, if you are speaking to the person, is the person able to respond? Now, is the patient only responsive to pain? That is, maybe you gave injection and patient is only able to react to that pain, but patient cannot talk. Or unresponsive, that is, none of these, whether talking, pain, none of it is able to wake patient up. Then you take. However, you spoke with your patient, all right, you had a very good postnatal care discussion down with your patient, so she was definitely alert. You do not need to take over here. You move along. When you did your maternal observation, was blood pressure, the systolic blood pressure, that is the upper number, was it less than 90 millimercury? Yes or no? If it's a no, you do not take. If it's a yes, you take. Heart rate more than 130 beats. When you had your maternal observation done, or even when it was done for you, on the Meows chart, was the maternal pulse greater than 130? Greater than 130, yes or no? If it's yes, you take. If it's a no, you do not take. Let's say that in my scenario, it is yes. I will want to move along here and take. So that means that I have take one, which automatically qualifies me to move down along to the Y indication. Then we have respiratory rate. Greater than or equal to 25 beats. Is maternal respiratory rate in that situation? When you check the respiratory rate, were you having greater than or equal to 25 beats per minute? Then you will want to take that. Needs oxygen keep, so that is your maternal oxygen saturation less than 92%. When you did your maternal observation, was saturation less than 92? If it's less than 92, then patients would definitely need an oxygen. If it was more than 92, patients wouldn't need an oxygen. Non-blanching rash, malted, ashen, or cyanotic. Is there any rash, or is there any wound which is blanching, which is non-blanching, which is malted, which is ashen, which is cyanotic? If any of these qualify, you will want to take. If none of them qualifies, you will leave it blank. They're not passed during the last 18 hours. If you did a very good postnatal check, you should have asked this woman, okay, Helen, can I inquire a few information about your bladder check? When was the last time you passed urine before we had this assessment? And she was like, oh, that was around 5 hours ago. Can you give an estimate about how much urine you passed? Would you say it's a large cup full? Would you say it's 100 ml, 200 ml, 500 ml? Then maybe she told you that that was a lot. I would say probably around a liter. And it was very clear. Yeah, okay, that's okay. So now you have inquired about the time she had a bladder check, and the time she passed her urine, and also how many meals estimatedly she might have passed. Then you know that this does not qualify. But if you didn't have a good postnatal check, you didn't do about bladder check, you only asked, have you passed urine? Then she was like, yes, I've passed urine. You didn't ask. Now when you get here, you will be stuck. You'll be wondering, when was the last time she passed urine? You are now going back to go and ask the woman, Helen, can I confirm when was the last time you passed urine? That's not fair. That is not the best. So let's do a very good postnatal check so that we are able to inquire all this information in order for us to take the right information here. So let's say patients, in my scenario, my patient passed urine 5 hours ago. Then I wouldn't take this because this is saying 18 hours ago. Moving down, you say urine output less than 0.5 mils per kilogram per hour. Very interesting. My patient told me that she passed probably around a liter because she did pass a lot. That's very good. That was past, let's say, 5 hours ago. But over here, they are asking 0.5 mils per kilogram per hour. What is your patient's weight? For example, my patient is 70 kilogram. And they said they just need 0.5 mils. So if it's 70 kilogram, that means that your patient should be passing at least 35 mils per hour. So let's say 5 hours, my patient has passed urine. The last time she passed urine was 5 hours ago. And even, let's multiply our 5 by our 35. So if it's 5 by 35, let's see what our mass is doing. It will be somewhere around, it's definitely going to be less than 1,000 mils. So then I will qualify by not taking this, because when I did a very good postnatal check, I did inquire about the number or the mils of urine my patient take. So I can assume that even if my patient was passing urine every hour, it was still more than the 35 mils per hour. And even if it was 35 mils, it's still qualified because they need less than 0.5. So that is how little it is. So if your patient has not passed urine in the last 24 hours, or when she passed, it was very scanty, both of the two qualifies, and you are going to take. But we have even take our heart rate, which was more than 130. So definitely we are still going to move along to our Y colon, even if none of this information does not qualify. Moving down, we have lactate, which is more than or equal to 2 ml. Lactate is a blood test which is used to check for possible infection, or yes, basically, if it's a child, that is if you, mother was in labor and she had a baby, they had a cord gas taken, and baby had lactate of more than 5 millimoles, 5 millimoles per liter, then we will say that there was a possible sign of infection in the woman, in this situation, and she needs to be managed in a lactate pathway. Let's say that in adults, ours is less than 2. Greater than or equal to 2. So for us, we just need 2 millimoles to indicate possible infection. So let's say in your assessment, lactate was taken, blood sample was taken to check for lactate, and they gave it in a scenario that it was more than 2 millimoles, then you want to take. If that was not in the scenario, what do you do? Always confirm. Helen, can I confirm, before I did your assessment, did anyone come in to take your blood sample for any checks? If yes, what were the checks? If she doesn't remember, I can confirm with the examiner. Can I confirm the checks that was done on my patient? Or if, let's say, she said no, no bloods was taken on me, so okay, then no one took any bloods at the moment. Oh, okay, then that's fine. Then you wouldn't have to tick over here. You just move along. Now we ticked for maternal pulse. So definitely we are moving along our Y. And what does it say? It says red flag sepsis. Start sepsis pathway now. And this is time critical. Immediate action is required. Sepsis 6 needs to be done within an hour. And what are the things that goes into our sepsis 6? We will talk about it and how to hand over this information to the examiner. Now let's say over the number 3, there was no red flag indication. Let's say number 3, there was no red flag indication, so we are moving along the end part, and it moves, when you look at the arrow, is drawing us all the way to 4, which is any maternal amber flag trigger. So let's say which of them, if any of them is a yes, you will take. You just need one information to move all the way down. So let's say that ours went all the way to the yes, 3, which is red flag, and it is sepsis 6 pathway. That means you're happy to start your sepsis 6 pathway. And what are the 6 things that is involved in a sepsis 6? The first point is ensuring there is a senior clinician around. Second is commencing high flow oxygen. Third is taking blood sample. Fourth is administering intravenous antibiotics. Fifth is administering intravenous fluid. And the last set one, which will be monitoring urine output, fluid input and output, primarily urine. So you don't just say all these 6 points, then you are done. This is what I'll be doing. You will need to relate it to your scenario. So the first point, okay, examiner, I will commence my sepsis pathway, which needs to be managed within an hour, as this is an emergency, as this is an urgency. First of all, I will need my senior clinician around. I will need the time she arrived and also sign. Second thing I'll be doing is I'll commence my patient on oxygen. However, considering my patient oxygen saturation, which was more than 92 beats, I'm not happy to give my patient oxygen at the moment, but I will continuously monitor oxygen saturation to ensure that my patient's oxygen saturation is within normal range. The next thing I'll be doing is I will cannulate my patient, draw blood sample for the following blood tests, which is full blood count, blood cultures, blood glucose, lactate, liver function test, C-reactive protein, urea, and creatinine. So this is the blood test that you will want to take for someone in sepsis. After that, I will secure the cannula and administer broad spectrum intravenous antibiotics, which is prescribed for my patient, considering her allergies are not in those medication. Then the next thing I will want to do is I will also administer intravenous fluid, either sodium chloride 0.9% sodium chloride or Hartmann solution. Then the last thing I'll be doing is to monitor my patient's urine fluid input and output. Now, considering my patient whose urine output was not less than 0.5 and she also been passing urine frequently, there is no need for me to catheterize my patient using a Foley's catheter. However, I will want to monitor by measuring her urine output in a bedpan. So although you are going to monitor fluid input, and you don't necessarily need to catheterize your patient if your patient is passing urine well. You just acknowledge that you monitor, but this time you will give the patient a bedpan and she will pass urine in it, and you will just weigh the amount of urine passed. And that is also another way of checking urine input and output. So why do we check? In situations of sepsis shock, there can be acute renal failure or kidney failure. So if that is basically why we check these things, and that is why we check urine input and output, to ensure that the patient is not having that acute renal failure or kidney failure. I hope we have understood our sepsis pathway, and it is perfect and it is understandable basically. If you have any questions, please feel free to enter in the comment section. I'll be ever happy to reply to you. And if you want a one-to-one tutorial, face-to-face tutorial, whether virtual, you can also send us an email, which is pinned in the comment section. I hope you have enjoyed today's session, and the next time we will meet, we are going to talk about our API in an updated version. So we are going to do all the midwifery Osce videos again in updated version. Thank you.